I am Professor Ramon Hermida, Director of the Bioengineering and Chronobiology Laboratories at the University of Vigo in northwest Spain. My lecture today was about the sleep time blood pressure as a potential therapeutic target for cardiovascular risk reduction. So we review the many trials that have been published over the last 2 decades with studies based on ambulatory blood pressure monitoring, indicating that nighttime blood pressure seems to predict cardiovascular morbidity and mortality in a better way than clinical blood pressure measurements or even the daytime blood pressure derived from ambulatory blood pressure monitoring. Problem with those studies is that, well, as being based on only one ambulatory blood pressure determination per patient, they were not able to evaluate if changes in daytime or nighttime blood pressure evaluated by ambulatory blood pressure recordings due to antihypertensive treatment could indeed be related to changes in cardiovascular morbidity and mortality. From that point of view, the MAPEC study that was reported a couple of years ago and was actually the first published so far, where the patients were evaluated with ambulatory blood pressure monitoring repeatedly, at least yearly, for a median follow-up of 6 years. The results of that trial clearly indicate that the progressive reduction of nighttime systolic blood pressure with antihypertensive treatment was the most significant and independent prognostic marker of increased survival from cardiovascular, cerebrovascular morbidity and mortality. The results basically indicate also that when patients were randomized to ingest at least one of their antihypertensive medications at bedtime, there was a significantly increased reduction in sleep time blood pressure, and that was also significantly correlated with increased survival and with a reduction of cardiovascular events, basically cardiovascular mortality, myocardial infarction and stroke by over 60%. The results, of course, need confirmation, but confirmation from studies that are already undergoing now in Europe and also here in the United States, and they suggest that the stratification of cardiovascular risk should be based on ambulatory blood pressure monitoring, mainly on the blood pressure that the patient may have during sleep, and from the therapeutic point of view, that the time of day when the patients take their medication should also be taken into consideration in the ongoing prospective trials, potentially giving preference to bedtime treatment in order to increase efficacy of the medication in reducing nighttime blood pressure and potentially also in reducing cardiovascular and cerebrovascular morbidity and mortality.